This is part 3 of chapter 1. Picking back up on where I left off, the last thing I discussed was negative feedback mechanisms in terms of homeostasis, homeostatic control of the body. Again, let me just review this real quick. Most of your body will use a negative feedback mechanism. So let's say, your body, your temperature, for example, goes out of a comfortable range for your body, or starts to trend a little high, all right, you're a little warm. It will do various things to bring your temperature back down and reverse the process that's going on right now. That's negative. Negative is reversing it. Positive feedback mechanisms actually push what's going on further. This almost never occurs. The two examples you're given here are in blood clotting and birth of a baby. With childbirth, it's going to push further the signals that the body is receiving, or the brain is receiving from the body, so that the baby can be born. And with blood clotting, although you don't really want to bleed out, if you're bleeding, you've got to stop it. And there's really only one way you can do that, and that is to encourage blood clotting factors within your blood to get to the site of the injury. And you can't just stop pumping blood. You can't just tell your heart to stop so that you stop bleeding. So it's going to actually push on, and your heartbeat will increase, and it will push blood to the site of injury to encourage those clotting factors to get there faster, and so that it can stop the clotting, because the blood is where these clotting factors are. It has no other way to get there. So those are two examples of a positive feedback loop where your body is sensing something going on, and it actually doesn't try to stop it. It actually wants to encourage it, because it wants this process to see its own way through. Alright, and lastly we have just some anatomical things. These are just some terms that we use to identify very specific regions on the body. I call these body regions. It calls them landmarks here. You will have a list of these, you may already, and we'll kind of go through and highlight the ones I want you to memorize. You will have to label some of these on a test. Some of these you already know. Nasal, right? Oral, umbilical, right? These are some terms we're familiar with already, so that'll make it a little bit easier for you. Also the posterior side of the body. Again, posterior means back, anterior means front, and there are several here as well. Here are those body planes that I showed you earlier. These are the exact same thing, except using the same image you would see in your textbook, and they use a couple of different terms for each. You have the mid-sagittal plane or the median plane. I use the term mid-sagittal more often. The frontal plane you may also see called the coronal plane. And the transverse plane, again, you need to know these planes and the terms associated with them. And then below you just see a few pictures of what the body may look like if you had an image across these planes in different parts of the body. Alright, then we have some body cavities. Body cavities are really just hollow areas within the body that are going to house various organs, and we give those names. The cranial cavity is really within your skull. It's the cavity created by your skull. Thoracic cavity is your chest. The diaphragm is the muscle that controls your breathing. It actually separates the thoracic cavity, where your lungs and heart are, from your abdominal cavity below. Your abdominopelvic cavity is really abdominal cavity and pelvic cavity put together. They're really one big cavity. There's not much to separate them. They're just kind of different regions within a similar area. They have different organs there that have different jobs. So we kind of, in our minds, separate those two. But the abdominopelvic cavity is the name for the whole thing. There's also the spinal cavity. We don't discuss a whole lot, but it is an area for your spinal cord to reside in. You have these abdominopelvic quadrants, which help us to know specific areas when we're communicating about the abdominopelvic region. And this would be a very good opportunity for me to stop and tell you, if you don't know already, that whenever we discuss things in anatomy, we're going to discuss things according to our patient, for instance. So if we're talking about a person's left or right side, we're not going to use our right or left side. We're talking about that person's right or left side. So go ahead and get that kind of in your mind, that anytime you look at someone, you're gonna kind of flip it. So over here we have the right upper quadrant, because it's this person's right side. Okay, and here's the left upper. We got left lower and right lower as well. So those are pretty easy to label. These have some kind of funny names. These are abdominopelvic regions. So the last picture we saw were quadrants, where we divide it into 4, and these regions help us get even more specific, because we have a lot going on, beneath the surface here. A lot of different organs performing different jobs. If you have pain in a very specific region, it can tell us what organ it may be coming from, if that's the case. So memorize these terms. You will need to know them. Here's what our t-shirt project will be about. For the most part, you have a couple of options, but the main idea is to sketch out where these major abdominopelvic organs are, their real life size, and some of their functions. Alright, that brings us to the end of this slideshow, and before this is over, while I still have some time on this video, let me take you to the class website and show you an assignment. Alright, so you will go to martinanatomy.wikispaces.com, the class website. Here's the home page. We're going to go to this chapter 1, which is titled Body Organization on the website. And one of the big assignments I would like for you to look at, there are others here as well. You see you have the information for your t-shirt project. The notes that we just looked at are here. But if you'll go down to the bottom, which this may could look different for you by now, but it will be on here somewhere. Click this homeostasis research project. I'll go ahead and give you a little introduction to it. Let's open it up. This is going to be an individual research project where you will research a specific homeostatic feedback system within the body. What you will need to give is the information listed here, simply the name of the system. It may have a specific name. You may need to just describe it. You're going to give me the function of this feedback system, what the normal set point levels are. I give you an example here. If you're talking about blood pressure, a normal blood pressure is at or below the level of about 120/80, for example. So that would be the normal level. Whether this is a negative or a positive feedback loop, again, most of these are going to be negative, but you're going to need to tell me if it's negative or positive. You may have one of those couple of rare things that is actually positive within the body. Tell me the sensor mechanism involved, the affector. Where in the body, what is in the body that senses these changes that's happening? What is the afferent signal? More than likely, it's just a nerve impulse to the brain. Tell me the control center involved. This will be the specific part of the brain that's going to make the decision about whether the body is in its acceptable range or not. Okay, so get specific with that one. The efferent signal, this is either going to be a nerve signal or a hormone. Tell me the effector mechanism, which organ of the body is going to make the change to get that range back to normal, whatever that may be. And then a few things that I want you to include in your project, your presentation. And by the way, I don't care what you make. It can be a PowerPoint. You can write an essay. I don't care how you present it to me, as long as you have this information. A poster, whatever you want to do. But whatever it is you make, include a graph communicating information. I don't care what the graph is, as long as you have a graph there. Tell me the symptoms displayed in a person who is out of balance. Right? If this is someone whose temperature is out of balance, let's say they're too hot, right? We're going to see that their skin is flushed, right? They're going to be sweating. Those are just a couple of examples of symptoms. And then finally, the consequences of a person who remains out of balance, both short-term and long-term. because eventually long term on most of these could be serious injury or death. But give us short term. You know, it may be more symptoms that we would see or more severe symptoms. So tell me short term and long term. Be very detailed and specific, naming each of the organs, hormones, or whatever may be involved in this system that you have chosen. Include all of the pertinent vocabulary. Go ahead and talk it up and sound smart. Don't make it fluffy. Use your scientific terms here. Use your terms in your terms list for this chapter. There'll be a lot of them. Even if you don't know what those words mean, look them up. We're in the age of Google, and no excuses. You can look up what any of these terms mean. So include it and be able to explain it if I ask you a question about it, because I very well may. I want to check for your understanding. Now, here are a few ideas for you of some of these homeostatic mechanisms that you can choose from. I want to try and get a variety because there aren't just a whole ton of them I can think of. Then we may double up on some of these, and I may have another list, and this assignment may look slightly different because I may add to it as I think of it. But some of them that you could use are listed here. A couple of these down here, lactation, here's another positive feedback loop, one of those rare ones that wasn't in your slideshow, but is another very good example, one of the very few that exist. So think of something that interests you that might be on this list or you can think of outside of this. Hunger is one that's not on the list that I can think of. Hunger and feeling hungry and choosing to eat is actually one of those types of things. So there's some of them out there that I haven't put on the list that you can think of, and have that approved. I don't want too many people doing the same assignment. If you have any questions, you can email or come by and ask me about it. All right, so this here will conclude all of Chapter 1. Took 3 parts to do it. Hopefully it won't keep doing that. But that should be some good review information for you and help you out on this assignment. All right, so that'll be it. Thanks for watching.